It's a common confusion, especially for anesthesia postgraduates, about succinylcholine induced desensitization and phase 2 block with respect to mechanism of action. Whether these two are same or different, let's clear this confusion today. Hello everyone, I am Dr. Faraz Ahmad, done my masters in anesthesiology and will clarify the concept of succinylcholine induced desensitization and phase 2 block. So let's begin. As we all know, at the neuromuscular junction, there are acetylcholine receptors. These acetylcholine receptors are made up of 5 subunits in total, out of which there are 2 alpha subunits, and on those 2 alpha subunits, there is a binding site for acetylcholine. So 2 molecules of acetylcholine come and bind over one acetylcholine receptor, causing opening of the channel, resulting in movement of sodium ions inside the muscle membrane, resulting in continuous depolarization. So now, how are these receptors getting desensitized? The acetylcholine receptors are present in lipid bilayer. Since these acetylcholine receptors are present in a flexible and fluidic environment, they are capable of existing in a number of conformational states. And these receptors that are present in different conformations cannot be opened by the agonist. And some receptors does not open even after the agonist comes and binds to them. In other words, the receptors will not be sensitive to the agonist. This state of insensitivity is called as desensitized state. There are several different conformations of proteins that are known, and since acetylcholine cannot cause the ion channels to open in any of them, they all are included in a functional term of desensitization. And since these receptors are present in a flexible and fluidic environment, we can say that they will be in transition between sensitized and desensitized state. And how is the desensitization occurring by the agonist? It is either they promote the transition to a desensitized state, or they bind very tightly to a desensitized receptor, hence trapping them in a desensitized state. There are many other drugs used by anesthesiologists like thiopentone, neostigmine, inhalational agents, etc., which also promote the shift of receptors from a normal state to a desensitized state. So what is happening here? Even though the agonist is present, even though the agonist comes and binds to this kind of desensitized receptor, the channel do not open and there will not be any entry of sodium. So now what can happen because of desensitization? If many receptors are desensitized, then insufficient normal ones are left to depolarize the motor end plate, and hence neuromuscular transmission will not occur. The system will be more susceptible to block by conventional antagonists such as atracurium or vecuronium. So now we have understood what is desensitization. It is nothing but a insensitivity of the receptor to the agonist. Also, even if the agonist comes and binds to these desensitized receptors, they may not open and they may actually get trapped in the same desensitized state. So this was about desensitization. Now coming to phase 2 block. Before we start phase 2 block, let us understand what is the phase 1 block. Normally, when succinylcholine is given, the succinylcholine comes and binds over the same alpha 2 subunits over the same site where acetylcholine comes and binds, ultimately resulting in continuous opening of the sodium channels and persistent depolarization, which ultimately results in conduction blockade and muscle paralysis. And when we look at the train of force response, we can see how the amplitude of the muscle twitch reduces after administration of depolarizing muscle relaxant. So either it will be reduced or there might not be any response at all. So this is phase 1 block, which will be happening after administration of depolarizing muscle relaxant. Now what happens, just let me tell you what will happen if you give non-depolarizing muscle relaxant in train of. So when we administer non-depolarizing muscle relaxant in train of force response, we see a sequentially reduced amplitude in contrast to the uniformly reduced amplitude. So this is the train of force response for depolarizing muscle relaxant, and this is the train of force response for non-depolarizing muscle relaxant. However, can we see a fade response when we administer depolarizing muscle relaxant? Yes. So when does that happen? When a higher concentration of succinylcholine is given, a fade response in the train of 4 will be seen. And this typical fade response in train of 4 after administration of depolarizing muscle relaxant, especially succinylcholine, is called as phase 2 block. So why and how is succinylcholine causing phase 2 block? To understand this, let us go to the neuromuscular junction. In the neuromuscular junction, the succinylcholine goes and binds to the acetylcholine receptors, causing persistent depolarization and the blockade. This was the regular action of the succinylcholine. But if you give a higher concentration of succinylcholine, it also goes and binds over the presynaptic acetylcholine receptor, interfering in the release of acetylcholine. So we can say that there is both presynaptic and postsynaptic blockade. This is one of the mechanism. So what are the other mechanisms now? So because of the persistent depolarization, more and more sodium starts going inside the cell membrane, and along with sodium there will be entry of calcium as well. So what has happened now? More of the positive ions that are coming intracellularly. So now sodium potassium ATPase takes its action, tries to put out excess of the sodium and takes the passive potassium ion in. So ultimately what is happening here? There is an electrolyte imbalance that has occurred. And this electrolyte imbalance is causing distortion in membrane function. This is also one of the mechanism. And also there are few anesthetic drugs that can interfere with the release of acetylcholine by acting presynaptically. And the last mechanism that we have already discussed is desensitization. The prolonged exposure of acetylcholine receptor to succinylcholine results in desensitization and hence resulting in phase 2 block. So now we can see there are multiple mechanisms involved for development of phase 2 block. It can be either presynaptic blockade, the persistent depolarization causing electrolyte imbalance, the prolonged exposure of succinylcholine causing desensitization, or the anesthetic drugs itself. This is a very complex process. So what I am trying to tell you is, you cannot use cholinesterase inhibitors for the reversal of this process, because we do not know whether it is just a single mechanism that is affecting it, or it is a combination of multiple mechanisms resulting in phase 2 block. So now you have understood that phase 2 block and desensitization, which were frequently referred to each other, are not the same, and desensitization is just one of the many mechanisms of phase 2 block. In conclusion, desensitization is acetylcholine receptor being insensitive to agonist, and phase 2 block is muscle showing fade response after administration of succinylcholine, and that can be due to multiple mechanisms, and desensitization is just one of the mechanism of phase 2 block. So this was about desensitization and phase 2 block. Hope you have got clarity of the concept. Like this video, share it and help in spreading the knowledge. You can comment for topics you want me to make a video on. Thanks for watching. This is Dr. Faraz signing off.